we do want to we do want to make sure that people have the opportunity to provide feedback and ask questions. So you're welcome to raise your hand along the way. We'll be monitoring that as well as the chat to ensure that if there are any questions brought up in the queue, that if it's not appropriate to answer them right then and there, that we'll come back to them and make sure that you have a response. Did want to let everyone know that the slides will be available for you on our Transition Services website. If you are listening by phone and you want to participate, if you're not able to be here online, you are going to be muted. So if you would like to unmute yourself to speak, you can press *6 on your phone. Or if you would like to appear as if you are raising your hand, you can press *9. And that will indicate to us that if you are on the phone, you would like to offer something. Please, if it would be beneficial for closed captioning for you, go ahead and click the closed captioning icon on the bottom. I did want to let people know that the department is not allowing external use of AI note-taking bots in our meetings at this time without an advanced accommodations request. So if for any reason you would like to have an accommodation for AI meeting notes or anything else that might make this meeting more accessible and valuable to you, you can see John Barry's email down there at the bottom right, and emails can be sent directly to him so that we can make sure to address your accommodation for any future meetings. So with all of that said and the foundation laid, if we can go to the next slide, we'll dive right in today. So first and initially, we don't have a lot in the way of council business. We've got a nice agenda for you today. And so we know that many of you have been interested in learning more about what's going on with the Department of Justice agreement. And so we have Jill Schnotthorst, who is our Compliance and Innovation Director, and the person I'm lucky to call my boss, here with us today to talk with us about the agreement and help provide a little bit of information about what you might be able to expect and see in the future. I am going to also spend some time with this group following Jill's presentation, providing some training about money follows the person. As we've discussed consistently with this group, we are targeting the beginning of next year for the release of our new Money Follows the Person demonstration. And so today we will be offering a very high level program overview training to begin orienting us to the work that's coming up. And then at the end of our presentations, we would love to hear from all of you. And so if you have questions, if you have topics, whether it's a program win that you would like to share or something that you've been experiencing locally that you'd like to talk through and see what others are doing, we'll close our day with the open forum. So without any further ado, I will turn it over to Jill. And Jill, if you want to say hi, then you're welcome to take it from here.
Awesome. Thank you so much, Matt. And hi, everyone. It's nice to see you all. If you don't know me, my name is Jill Schnotthorst. I'm the Compliance and Innovation Division Director here in the Office of Community Living at HCPF. And another hat that I wear is the Department of Justice Settlement Agreement Coordinator. So working very closely on the agreement. If we could go to the next slide, please. So what I wanted to talk to you all today about is just a high-level summary of the agreement, and then the programmatic changes that we'll be making under the agreement, different metrics that we're required to meet, who's going to be involved, some of the roles and responsibilities under the agreement, and then also give some time for questions. I know we've talked about this a little bit in the past, but also want to be able to answer any questions that you all might have now. I am going to talk about this at a pretty high level. However, in the chat, I just dropped a link to be able to reach the full agreement. So if you're interested in reading further detail there, you can follow that link to see the full agreement. Next slide, please. Okay, so high level summary of the agreement. Um, as you all probably remember, back in March of 2022, the Department of Justice submitted a findings letter to the state that stated that we were out of compliance with the Americans with Disability Act for operating our long term services and support system in a way that resulted in institutionalization. After that findings letter, we met with a lot of stakeholders, including you all, to get a better understanding of what your feel was for this space. How could we improve the transition and diversion processes in Colorado? And with that feedback, we took proactive action. We had 3 bills that were passed, 2 budget requests to resource us to really make progress in those areas that we heard from you all were really important to improve. In September 2023, the DOJ filed the lawsuit against Colorado, but we started the negotiation process in February. We felt like because of this ongoing work with you all, the strategic efforts that we had been putting in place, that the state was in good position to negotiate a settlement that would help us advance Colorado's goals towards these efforts. Ultimately, we were able to reach a settlement agreement that was signed on Halloween, October 31st, 2024. And a couple of key components of that agreement is it's a 4-year agreement. So we have 4 years to implement the programmatic requirements and meet the metrics. It also builds on the work that we've already been planning and are resourced for. So when we go through those programmatic requirements on the next slides, I think you'll recognize a lot of those because we've been talking about them for a little while now. And then, as I mentioned earlier, there are 2 main pieces of the agreement, the programmatic commitments and then also metrics that we have to hit. Next slide, please. Okay, so on the programmatic side, there's a list of initiatives that we have to implement to improve the transition process and diversion efforts. A lot of these are really focused on the information sharing component of transitioning. And what we heard from you all and also discussed with the Department of Justice is how important it is to make sure that people living in institutional settings have they know what their options are. They know about community-based services. They know about transition supports to help them get there. And so a lot of these initiatives are really focused around that information sharing and helping support a member in making a choice on where they would like to live and receive services. The first initiative, or I guess there's 2 in here, is group and individual in-reach counseling. So this is that component where in both a group and individual setting, we'll proactively meet with members in nursing facilities to do exactly what I was talking about. Make sure that the member understands home and community-based services and other community supports. Make sure that they understand what transition coordination is and how that service might help them transition into the community. I know a number of you on the call are involved in that process with the ADRCs. So thank you very much for your help and support as we've been implementing those programs and developing them. The next one is rapid reintegration and referral. What this piece is really aimed at is for people who decide that they're ready to move into a nursing facility on a long-term basis. We're trying to make sure that at that contact point with the case management agency, that they fully understand all of the options available to them in the community. If during that period an individual decides that they would actually prefer to live in the community, we have 2 options there. One, the case manager could make a referral to transition coordination so that we can connect that individual with additional supports to help them quickly get back to the community. There's also the rapid reintegration plan option. With a rapid reintegration plan, the case manager will really follow along that member during their short-term stay in the nursing facility to make sure that all of the pieces are put in place to help them move back into the community. Both those programs are ones that we're working with our case management agencies closely on and are in the development stages of that piece, working to get the contracts and rules in place. The next piece is institutional risk identification and outreach. So, what we mean by this is we've been working really closely with some statisticians within the department to develop an algorithm and risk score to help us try to identify people that are already in the community and might be at high risk for needing nursing facility care in the near future. If you all helped us out with a survey that we sent out pretty early on in the DOJ stakeholder work. There was a question on there about, what makes somebody the most at risk for nursing facility or institutional care? And you all gave us some really good feedback. It's things like change in caregiver, it's multiple hospital visits, it's previous nursing home visits. So we took that feedback from you all. We did a bunch of literature review. We did some data analytics and have developed this model to help identify people. The DOJ and our monitor, who will be overseeing compliance for the agreement, are reviewing that algorithm and risk score development right now. And once that's approved, we'll be able to start doing outreach to individuals identified through this process. Those lists of individuals will be sent to both the case management agencies if the member is receiving home and community-based services, or they'll be sent to the regional accountable entities or the RAIs if they don't have a case manager. The next component that goes really hand in hand with that at-risk identification is housing supports. So one thing that we were able to do through a partnership with the Department of Local Affairs was get some additional housing vouchers for the populations identified in this settlement agreement, including those that are at risk of institutionalization. So folks that are identified as at risk, as part of the outreach that the case managers or RAIs will be doing, will include assessing whether or not someone needs housing supports. And if they do, we'll be able to connect them to transition coordination, housing navigation, and vouchers as well. So that's something that's really new. We're very excited about that. We know that housing can be a huge issue for a lot of people. And we heard that from you all as well. Another exciting component is community first choice. So really expanding consumer direction in Colorado. The submission of that application to our federal partners was included in the DOJ agreement. That's something that we were able to submit a few weeks ago with a targeted implementation date in July. And then another component that you all have been part of the discussion on and very helpful in the development of is presumptive eligibility for long-term services and supports. And that is a program that we are targeted to implement in January 2026. We're working through the federal application process now. So that was a lot, and I promise there will be time for questions. Thanks for the next slide, Chanel. On the metric side of things, so those were the programmatic changes that were required to make per the DOJ agreement. There are also metrics that we have to meet to ensure that we are compliant. And there are really three essential metrics that have to be met. The first one is a transition goal. So for the transition goal over the 4-year period of the settlement agreement, we have to transition 2,000 individuals from nursing facilities to community settings. There are also some requirements within that 2,000. 950 have to use the transition coordination service, and then 1,050 have to transition and use additional supports in the community. These are pretty lofty goals and metrics, but we do feel confident that with a lot of the changes and partnerships that we have with you all, that we'll be able to meet those metrics. The next metric is related to diversion. So that at-risk modeling that I was talking about and identification and outreach process. What we're required to do with this diversion metric is for those folks that are identified through that process, we have to make sure that they are able to remain in the community. And what we need to see year over year is improvement in the percentage of those individuals that remain in the community. So, for example, if currently about 70% of people as a baseline would remain in the community, in the next year we would need to increase that to 73 or 75. I can't remember the exact percentage um, on that little piece, but in the agreement, there is a table that talks about how much we have to increase year over year, depending on where we're at on the baseline. So the goal there really is to make sure that we are identifying people most in need and helping them remain in the community if that's where they choose to live. Next slide, please. And then the third metric that we have to meet, so this one is a little bit confusing. Feel free to ask questions on it. But during the third year of the agreement, the monitor will conduct a study. And during that study, they will assess how many individuals are remaining in a nursing facility that do not oppose community living, are capable of living in the community, and are not yet receiving transition supports. If that number is fewer than 450 individuals, we get to end the agreement early. We don't have to meet those transition metrics. So really the goal of this study is to make sure that people that are in a nursing facility have the information they need to make an informed choice on where they want to live. So that's kind of the goal there. Next slide, please. And as you can imagine, there's lots of people that are involved in this. This is a lot of work, a lot of really great efforts that we'll be making to improve this overall system. And a lot of that weight falls on both HCPUF and the Department of Local Affairs, DOLA. Both HCPUF and DOLA, the majority of the requirements fall on the HCPUF side, are responsible for implementing the objectives in the agreement and meeting the metrics. Of course, that means partnership with you all as well, right? A lot of you are involved in helping implement the group and individual inReach. Currently doing options counseling. We have transition coordinators on the line. So with this is a partnership and a really a team effort in the space that we're already in. What this could mean for you all is that you could be outreached by the monitor or the Department of Justice to answer questions, provide additional documents. Those requests may also come from the department to make sure that we have documentation in place and that we have the appropriate oversight of the programs. As I mentioned, one individual that may be reaching out to you is our settlement agreement monitor. Her name is Melanie Reeves Miller, and her responsibility is really to review the state's effort and determine agreement. Melanie may reach out to you all, stakeholders, providers, members, to help her really learn the Colorado transition and diversion ecosystem, as well as to ask questions or additional information in determining compliance. And we are lucky to have Melanie on the line today. Melanie, are you in a place where you could introduce yourself?
I will try. Can you hear me?
Yes.
Good. Um, Hello, everyone. I am Melanie Riggs Miller. I am excited about being the monitor and working with all of you. And as Jill stated, yes, I will be reaching out to various stakeholders and asking lots of different questions and wanting to meet and get to know Colorado. So Some of those stakeholder meetings will start happening next week. But I will be in Colorado as frequently as possible, and look forward to helping the state and you guys meet the metrics and the expectations of the agreement.
Great, thank you, Melanie. The Department of Justice also still plays a role in the agreement, and their role has shifted more to making sure that we are in compliance with the agreement and confirming that, working closely with Melanie and with us. And we do have a few folks from the Department of Justice here with us as well. So, Julia, do you want to introduce yourself first?
Sure, and this was exquisitely timed for when my kids got home from school, so if you see them run out in the background, that's why. But I'm Julia Graff. I'm an attorney in the Department of Justice, Civil Rights Division, Disability Rights Section, and I have met some of you and look forward to meeting others of you. I am joined today by my colleague Jen. If you want to say hi.
Sure. Hi, I'm in the same office as Julia on the same team, and also look forward to working with you all and meeting those who we haven't met yet.
Thanks, Jill, for the intro.
Yeah, thank you all. Really appreciate it. Okay, well, that kind of gave you a high-level overview of some of the programmatic changes, the metrics that we have to meet to come into compliance with this settlement agreement. Like I mentioned earlier, if you'd like to read more of those details, those can be found in the link that I put in the chat. That has the full settlement agreement and will give you a lot more detail on the components and requirements that I talked about today. And I do see one question in the chat from Lisa. The question is, who is monitoring either the physicians or facility staff that are gatekeeping people transitioning, saying that the person is not appropriate to transition when they have been found feasible? That is a good question, Lisa. So when those types of cases are escalated to our team, we work really closely with the nursing facility and nursing facility staff to work through those issues. I know that those can be escalated either by the member, social services directors. They can come to us from transition coordination agencies or from the local contact agencies as well. So please continue to raise those issues to the department as you see them coming along, because we'd really like to work through those with you. You can, I see your question, Rhian, and thank you very much on who is the primary contact. So we are working to put together an escalation process. We know that in the past, folks have reached out to Nora or Matt, or have talked to case management agencies, and we're really trying to create a central place for any sort of transition or diversion escalation to go through. We're not quite ready to release that link, so if you have any cases like that, feel free to send them to me directly and I'll get them to the right place. I'll put my email in the chat right now. And then as soon as we have that escalation process ready, we will go ahead and share that with this group as well, so we can start working on that process. And thank you for raising that issue. Are there any other questions about the agreement or any of the programs metrics?
Jill, this is Melanie. Melanie again. At some point, I would like for you to share my contact information with this group. We're still working out the logistics of that, as you know, but at least have the information shared and that people are welcome to reach out to me.
Okay, that sounds good. Yeah, we'll get that out. Great, thank you.
Jill, this is April. I have a question. So for the 2,000 clients, is that going to be, of course, that's statewide, but is there any certain numbers that certain regions have to hit, or we're just kind of working all as a as a team and trying to get to that 2,000 altogether?
Yeah, good question, April. It's the latter. So we're working as a team statewide to hit those metrics. I didn't include it on the slides, but there are some additional components that are requirements in that 2,000. For example, the individual has to be in the nursing facility for more than 30 days. So it doesn't count if someone goes in for, let's say, like a 10-day rehab stay or something like that. The other piece that I think is really important as we're counting or looking at this as well is that an individual does not count if they transition to the community and then go back to a nursing facility due to lack of services. And there are a couple of other criteria that have to be met there. But the main breakout of that 2,000 is using the transition coordination, and then using any additional supports in the community to remain there. Another really nice thing is that if we have more individuals, more than the 950 using the transition coordination process, we do get to count them towards the 1050. So there is a little bit of flexibility in there in hitting that 2,000, but we're looking at it statewide, not regionally.
Okay. And then another question that you brought up too is, you said that if they leave the facility and then they go back, that doesn't count. Will we know which clients ended up back at the facilities? Like, how are we going to know as like option counselor transition? How would we know that they went back to a facility?
Yeah, so that is where we're going to really rely on the data that we have available through the department. So we'll be able to look back. So my plan is that we'll be able to identify people that have transitioned, and then I'll be able to update a data pool on those individuals. And one of the things that we'll be looking for is whether or not they had been readmitted to the nursing facility, and have that flagged for us. And then we'll be able to reach out to that member or work with you all to talk with that member, try to understand why they went back into the nursing facility and see if there's additional supports we can offer to get them back in the community. So I think we'll have to really rely on the data for that piece, April. It's a good question.
Okay, thank you.
Yeah, thank you. Any other questions? Okay, well, as you all know, we're in the process of building out a lot of these programs. Some of them we've been able to get off the ground, like the group in reach counseling. Another component is expanding the number of units of transition coordination. We did that a while ago. So there's some pieces that we have already implemented, some that are in the process right now, and then some of those pieces that we're still in kind of that development phase of things. And so I just wanted to say thank you to all of you because you've been instrumental as we've worked through all different pieces of that. And I think we've set ourselves up really nicely to be able to come into compliance with this agreement. More importantly, make the system better for our members. And we wouldn't be able to do that without your partnership. So thank you for that now and in the future as we continue to work through these different things. And of course, always appreciate your feedback in these meetings as well. And I think that is it for slides. I had a questions one, but I forgot to tell you next, Chanel. So if no other questions there, I'll pass it off to Matt.
Wonderful. Thank you so much, Jill. That was very helpful. I know people have been interested in learning more. So I think that this was a very welcome opportunity, and it was great to meet some of the people that we'll be working with. So thank you very much. Now, as we shift a little bit, as Jill mentioned and alluded to, there's a lot going on. There are a number of different initiatives that we have in motion to try to ensure that we have as robust a support for members accessing community-based care as possible. So for today, I would like to talk to you a little bit about Money Follows the Person. Today's training is really intended to be a high-level overview where we share what Money Follows the Person is, who it serves, and how to get connected. I did just want to preface that there will be an additional training offered at the beginning of 2025 that will dive a lot deeper into the actual program operations, guidance, service requirements, provider requirements, enrollment, and so on. So today is intended, again, just to give you that high level awareness so that you can start to develop better insight about what to expect and generate some questions where you may have them. Chanel, if you wouldn't mind going to the next slide. To ground us, I'd just like to begin quickly with our mission, where healthcare policy and financing is committed to improving healthcare equity and access and outcomes for the people we serve while saving Coloradoans money on healthcare and driving value for Colorado. The next slide, further framing and foundation. This occurs through the administration of Colorado's Medicaid plan, the Children's Health Plan, or CHIP Plus, and other healthcare programs for Coloradoans who qualify. Next slide, please. So as we begin today, I'd like to provide a little bit of background about Money Follows the Person, or the program we often refer to as MFP. We're going to review a lot of information in this training, and there will be time at the end for questions. I would like to save, if we can, questions until the end, until we've been able to cover all of the information in the presentation together first. And so with that said, let's talk a little bit about what Money Follows the Person is. Money Follows the Person is a federal demonstration grant intended to support opportunities for community-based living for members who live in a qualified setting for at least 60 days, such as a nursing facility, intermediate care facility for individuals with intellectual disabilities, and regional centers with the desire to live in the community. And as we talk about this, when I talk about Money Follows the Person as a demonstration, for context, when I say demonstration, I'm talking about a Medicaid program that allows states to demonstrate that by changing or creating Medicaid benefits, we can add value or expand access to resources for targeted populations. So we are really excited about this, and we're excited to be among shared company with some of our other states. This is a very well supported program throughout the country. There are 41 active participants right now, including 38 states, 2 territories, and the District of Columbia. We can go to the next slide. To help us orient a little bit to the new program, I'd like to discuss some of the history of MFP in Colorado with you. Many of you are familiar and have even been a part of the history, but just to make sure that we're all on the same page, as you can see on this slide, Colorado has been actively involved in the program for over a decade and continues to prioritize opportunities for community living through these ongoing programs. Bringing us to the present, in August 2023, the department received an award of $43 million from the Centers for Medicare and Medicaid to implement the new Money Follows the Person demonstration. This award ultimately represents the culmination of many efforts that include the state's former Money Follows the Person demonstration, which we've affectionately referred to as Colorado Choice Transitions, or CCT. This is not CCT 2.0. Let's just ground that at the beginning. And the implementation of permanent transition services that resulted from House Bill 1813-26 in January 19. So following a successful former demonstration of Money Follows the Person, we were able to implement some ongoing and permanent services to continue this important work. And in doing so, we've been able to really develop strong connections within our housing community, where both the housing as well as the transition coordination and support represent some key pillars of the program. If we could go to the next slide. The goal of money follows the person is really pretty clear and simple. I mean, it focuses on the fact that everyone deserves the choice about where they live and how they are cared for. Members have got to have the resources they need to move to the community and the ongoing support that they need to stay there safely without having to return to higher levels of care. In the new demonstration, we'll be looking at CCT, we'll be looking at our transition services and really trying to capitalize on lessons learned to reduce some of the critical barriers to accessing community-based care. And we really hope that this intensive support model will help members get there. You can go to the next slide. Before we get into Colorado's actual program and proposal, I just want to provide a little bit of an understanding around money follows the person. While its program goal may be clear and simple, there are definitely some nuances within the program that are helpful to understand before we start talking about the process and the services. So within Money Follows the Person, there are a few different buckets of services. At the top of this list, you can see the demonstration services really represent the foundation of a Medicaid demonstration. These, as I said, are the benefits that are being changed or modified to demonstrate that we can increase value to targeted members. Under Money Follows the Person, the states are required to make demonstration services available for 365 days following transition for each member. And so we'll get into the specific services in just a minute, but the demonstration is really the foundation, the key of what we're looking at. Supplemental services, on the other hand, are really a new opportunity. Supplemental services have historically been one-time expenses offered under Money Follows the Person that in practice really represented pest eradication, deep cleaning, or something along those lines that represented a barrier to community living that wasn't otherwise covered under Medicaid. In recent years, so in 2022, I believe, there were some changes made at the federal level to supplemental services that now offer supplemental services on a short-term basis where we can offer more than just a one-time expense, but we can actually offer support that is not otherwise available through Medicaid to members for a short-term period before or after the transition. And we'll break out each of those services in just a couple of minutes. Qualified services are those existing Medicaid state plan and home and community-based services. So this area of qualified services recognizes that while we may have created a new benefit that's available for 365 days and offered some supplemental care around that demonstration, members are still going to need the services that they've always relied upon, such as personal care, long-term home health, home delivered meals, those other programs that already exist. And so the benefit of Money Follows the Person is that through implementation of this program, we are able to capitalize on the cost of all of those services. And as you can see, sort of as the punchline at the bottom of this slide, each of these approaches to service result in a federal financial participation enhanced match for the state that ultimately results in state savings, where the state is able to use that money through the enhanced match for additional efforts down the line to further our home and community-based services. We can go to the next slide. So this is where we'll get into things a little bit more specifically. As we just defined, the demonstration services represent the foundation of the Money Follows the Person demonstration. And so for purposes of this demonstration, the benefit that we will be focusing on through change is our targeted case management transition coordination benefit. Through this change, we will be making that resource available to members for 365 days following their transition to the community. And we've also increased the number of units available to members, where 1 unit equals 15 minutes. We've increased the total number of units from 240 to 360 units to more holistically and comprehensively support that entire transition. Now, just to give you a little bit of a frame of reference where this might be different than what you've seen in the past, historically, transition coordination really focuses on the planning and the mitigation of risks that happens leading up to somebody's transition. Now, these agencies absolutely remain involved with that member, but the goal following discharge to the community is really about getting them connected to ongoing services until they are safe and stable with their home and community-based services. What we have learned through implementation of our permanent programs as well as through CCT is that the discharge, when a member moves home from the nursing facility to their new home in the community, they are just entering a brand new world in many instances. And so what we've really understood is that we need to better support learning and education on the front end when planning is occurring. And we need to make sure that people who are moving out into the community have access to resources that they trust, that they're familiar with, for the entire year following their transition, because we acknowledge that the needs that exist at the beginning are going to look different than the needs that exist at the end. And so this gives time for people to really develop a program that makes sense for them. And work with their transition coordinator to adequately plan for their transition, to develop a plan that mitigates risk, and ultimately find success in moving to the community. We can go to the next slide. Money follows the person's supplemental services. To start getting into this a little bit more, we just addressed the fact that money follows the person's supplemental services. Recently underwent a very valuable change. So in our money follows the person programming world moving forward, we will be allowed to offer specific services to members on a limited basis before and after discharge into the community. Each of these services has their own parameters and requirements, but are available depending on the service to members for up to 6 months in advance of their move to the community, or for 6 months following their move to the community. And so it's really an opportunity to build a whole lot greater support than can just be identified with one-time payments. I do see questions coming in, and so if it's okay, I will, as I mentioned at the beginning, save those to the end, but I promise I will come back to those. And can we actually go back to that last slide quick, Chanel? The one before it? Yeah, there we go. And so, one before it. And so one of the things, nope, one before it. There we go. And so one of the things that we want to recognize is that best intent only goes so far. We can really do well to develop well-intended programs, programs that on paper look really great, but unless we operationalize them in a way that really addresses some of these key barriers, we haven't really affected a whole lot of change. And so what we really want to recognize with the supplemental services is that eligibility and service authorization are challenges that we see throughout the system and throughout different settings. We understand that establishing eligibility for long-term care Medicaid and authorizing services under home and community-based service waivers can take a while. And so for that reason, we are planning to circumvent circumvent the standard case management service authorization process for these supplemental services. We will be making the 5 key supplemental services available either through a pre-authorized benefit package or through state contracts that allow us to make those services available at a maximum level right away. So that as soon as a member has identified that need and been referred to a provider of that service, that provider can start working with the member and can start billing for services rendered. So this is something that we're really excited about. And as mentioned, we'll be providing some additional information in upcoming trainings about provider enrollment. And so that will be able to provide greater understanding around those services that require enrollment through our existing Medicaid enrollment processes, or those that are overseen through our state administrative oversight. Now, if we could go to the next slide, we'll start getting into some of the services. So these next 5 slides are going to individually review each of the Money Follows the Person supplemental services that we are going to offer. And as we remember, the definition of Money Follows the Person supplemental services means that these are services that are otherwise unavailable through Medicaid. So first of these is Money Follows the Person Peer Mentorship, which makes peer mentorship available to members while they are still living in the facility. Peer mentorship is currently is provided by someone with lived experience to help members understand firsthand better what to expect and how to prepare for what they'll see during their transition. We have the benefit of utilizing peer mentorship for members under home and community-based services once they are in the community. But the implementation of this supplemental services recognizes that Medicaid benefit is not available to members while they are in the facility. And so this gives us a chance to begin working on that peer level with people while they're still in the facility for a period of up to 6 months prior to their discharge. The idea is that by aligning this with our existing HCBS peer mentorship benefit, it allows us to begin peer mentorship and develop those relationships while the member is still living in the community, and ideally continue them through home and community-based services following their move to the community, if that's what's appropriate and desirable for the member. And so it creates an opportunity for better continuity of care and to ensure that there are trusted people within the person's network who they can rely on, and who that they know are going to be there for longer than just right now. And so as far as the actual services go, we will get into more detail, but as I mentioned in additional trainings, but as I mentioned, this service is available to members for up to 6 months prior to discharge and provides members with up to 24 units of care where 1 unit equals 15 minutes. So it offers roughly 6 hours of support from someone with lived experience as they prepare for discharge. We can go to the next slide, please. Yep. Oh, no, you were right. Pre-tenancy. Pre-tenancy support is exciting because it's a new service entirely for our Medicaid program. The goal of pre-tenancy support is really to bolster the independence in a very holistic way. Colorado has been extremely proud of the housing resources that we've been able to integrate within our transitions program. You heard Jill talk a little bit about housing navigation and our voucher programs, and those are really monumental when you look at the landscape around the country. A directly state-funded voucher program is unique. And what we recognize is that for many people, that's kind of just the foot in the door. Finding somewhere to live, finding a way to pay for it through a voucher is absolutely necessary to give many a shot at successful community living. And there's more that we can do to make sure that those people feel like they have the ability to be successful. At the present time, in working with our housing navigation and our voucher programs, it's a very supportive process, as it should be. But we also want to ensure that where people have the ability and desire to direct their care, that we are supporting them through education and learning. And so the goal of pre-tenancy support is to help people acquire those skills and the knowledge needed to maintain their housing in the community. It'll provide people with education about tenancy rights, tenancy responsibilities, leasing obligations and processes, some of the housing law that might be applicable to their circumstances. And the idea being that with this information, we'll be able to increase the chances of success once someone has transitioned. That with this knowledge, people will be able to mitigate on their own some of the issues that may otherwise lead to returns to higher levels of care. And so we're really excited to be able to offer this to members for up to 6 months prior to transition. And similar to peer mentorship, this will be available for roughly 6 hours of services and supports for members before they discharge to the community, or 26 units where 1 unit equals 15 minutes. This, as well as the peer mentorship that we just reviewed, will be facilitated through our Medicaid enrollment process and will be billed through our Medicaid claiming system. We could go to the next slide. MFP food assistance really excites me. I'm just going to be honest. I think that the attention that Medicaid is starting to pay to food and housing is just extremely exciting. And so when we talk about food assistance, we're talking about a program that's really attempting to build on the existing resources we have. So when we opened this discussion, we talked about Colorado Choice transitions and some of the services that we were able to move into our ongoing and our permanent Medicaid program. One of those key programs was home delivered meals, and that is such an essential service for so many once they're in the community to be able to have a place to go where they know that they're going to be able to get a healthy meal. What we've seen is that this can take a little while to get set up. As with many of the home and community-based services, we've discussed that service authorization and eligibility can be challenges. So what we're doing with food assistance is making $500 available to members for the 30 days following their discharge. So this is intended to support members during that first month while they're in the community. And it really seeks to expand the way that we're looking at Medicaid food assistance. And so while it cannot directly pay for home delivered meals, as that would be a Medicaid duplication, what it can provide is payment for grocery items, perishable and non-perishable food, bulk items, things that people are going to need to be able to cook for themselves and make meals for themselves. If people are not in a place to acquire those skills or to utilize their own meal preparation as a plan, then the MFP food assistance also allows us to purchase food boxes or pay for community membership programs such as Meals on Wheels, with the intent being that this provides a bridge to that long-term planning. There is absolutely a caveat with this program that we cannot create a cliff. And so for each of these members, it is incumbent upon the team to make sure that there is a long-term plan following utilization of the money follows the person supplemental services. This will also be built into the pre-authorized benefit package so that $500 is available to that member to spend right away. And the benefit package pre-authorized will represent the 3 services that I've just spoken to. So MFP peer mentorship, pre-tenancy support, and food assistance will be available in our state's Medicaid system at a maximum level to begin service rendering and claiming right away. We can go to the next slide. The excitement continues. Environmental adaptations is, I think, one of the more sort of groundbreaking things that I've seen in a while. I'm very, very fond of this opportunity because one of the things that we have been unable to address for members for so long is how we can make somebody's home more accessible before they get there. For those of you that are familiar with long-term services and supports, you understand that home modifications are available under our home and community-based services waivers. Home modifications allow us to modify a member's community home. And so once somebody has been approved for home and community-based services, that resource is available to them to ensure that their home environment is accessible to them. Now, with that said, that program still requires that somebody is living in the community and authorized for home and community-based service waivers. So where that provides a very severe limitation is for those members that are already or that are living presently in a facility. Because if I'm living in a nursing facility, an intermediate care facility, or a regional center, I have not been approved for HCBS yet until I move to the community. And so what environmental adaptations allows us to do is to reimburse and initiate modifications to a member's home for up to 6 months while they are still living in the facility. So for somebody who is still living in the facility, if we know that there is a door that needs to be widened, a bathroom that needs to be modified, or updates in a kitchen, rather than those barriers continuing to exist in the home until they can be taken care of down the line, this is an opportunity for us to work with our occupational and physical therapists, work with our home modification providers, and achieve some of that work before the member has actually moved out into the community. Adding to this value, the environmental adaptations will not offset in any way or limit access to HCBS home modifications. So environmental adaptations will be available up to a maximum amount of $14,000 per member per transition for up to 6 months prior to their discharge. This still allows all of those members to utilize the full $14,000 available to them under their HCBS home modification benefit where appropriate. So again, looking at continuity of care and recognizing that life changes after you get home and you don't know everything that you're going to need to work through, this at least allows us to get someone home in a safe environment where they can explore how their needs are going to progress and change as we move forward. We are going to be implementing this program through a state contract. And so we'll be working directly with that entity to oversee and facilitate payment directly for these activities. Next slide, please. And to round out the last of our 5 MFP supplemental services, we'll talk about MFP housing assistance. Earlier in the presentation, I recognized that really the 2 pillars of our successful transition services and supports are reflected in our transition coordination and in our housing benefits. The state is extremely proud of the state-funded vouchers that we are able to offer to members who are in transition. And we recognize that there are still some challenges where currently there exist some barriers for certain members to be able to access that funding. So we will still be offering our state-funded vouchers to members who are transitioning or part of the Money Follows the Person program. But what the housing assistance will allow us to do is eliminate some of those existing barriers. So where a member may have outstanding payments for rental arrears, prior damages with a previous landlord, or any of those sort of outstanding housing costs. MFP housing assistance allows us to pay for up to 6 months worth of rental arrears, so that where those outstanding balances are an issue to future placement and to additional leases, we are looking at this as an opportunity to alleviate some of those pressures and make the likelihood of successful leasing greater for members where they do have some historical fiscal issues when it comes to their housing. Next slide, please. So now that we have learned a little bit about what the services are and sort of what you can access once you are a Money Follows the Person member, let's look at the process and how you can actually get connected. So when we are talking about Money Follows the Person eligibility, we are talking about adults, so members who are 18 years or older who meet long-term care Medicaid functional and financial eligibility requirements. These are people who have been living in a skilled inpatient facility, such as a nursing facility, an intermediate care facility for individuals with intellectual or developmental disabilities, or a regional center for more than 60 days. The Medicaid or the Money Follows the Person eligibility criteria also place some limitations on the qualified residence to which a member may transition. So just to highlight these two key differences, where this has a change from our current programs. In our current transition services program, there is no length of stay requirement. So if you're a member living in a skilled nursing facility, intermediate care facility, or regional center, you're able to access transition services right away, assuming you meet all of the other eligibility criteria. One of the federal statutes associated with Money Follows the Person is that a member must be in the facility for more than 60 days. So this will be a difference that we'll see moving forward. And the other thing that our transition services program has allowed us to do in our ongoing Medicaid benefit is to help support members who are moving from one of those skilled settings to a non-skilled assisted living facility. Under Money Follows the Person, that is not allowable. So under Money Follows the Person, members have the opportunity to transition to qualified residence, which includes a home that they own or lease, an apartment that they are living in, or a residence that they share with 4 or fewer individuals. So the length of stay requirements and the qualified settings to which members are able to discharge are the two key differences that you'll see in the program. I do just want to underscore that those new requirements are specific to Money Follows the Person. And so if for some reason somebody does not meet these MFP requirements, they do still have our ongoing and our permanent transition services available to them. It would just not include the supplemental and the demonstration services that we're talking about here, but it still would include the existing transition coordination and housing resources. If we can go to the next slide, please. When we talk about getting connected to Money Follows the Person and transition services, we really want this to be a process that is led by the member. And so when we talk about getting started, the first step in this process is really through options counseling. Jill talked to us a little bit about some of the differences between options counseling and in-reach counseling, as we are currently in an evolution of that program. So we'll get into that in just a minute. But we hope that by offering referrals through a variety of sources that we're able to really meet members where they are. So members can be referred to Money Follows the Person through options counseling, group in-reach counseling, through the pre-admission screening and resident review, or the PASSAR, We get referrals through the minimum data set questionnaire, or what we affectionately describe as the MDS Section Q, as well as the program's online referral form and other resources. And all of those processes are designed to be streamlined such that once that referral is made, it goes to the local contact agency to conduct options or in-reach counseling as appropriate and educate members about their community-based resources. So when I reference local contact agencies moving forward, what I'm talking about is those options counseling organizations or in-reach counseling organizations that meet directly with members to ensure that they have all of the information they need about the resources available to them in the community. And to help us better understand this, let's go to the next slide and dive into options counseling a little bit more. So as we just discussed, this options or in-reach counseling is the first step to money follows the person. The process begins with a referral to options or in-reach counseling, and historically, many of you are going to be familiar with our options counseling. This has been a responsive process wherein the state has contracted with regional groups that have historically been represented by our Aging and Disability Resource Centers, or our ADRCs, who work within their region to provide this direct communication to members so that they can better understand their resources. This has been something that we have been able to grow and evolve and expand to additional referral sources. However, in nature, it is still fairly responsive. And so as we evolve and ensure that we're able to meet members where they are and provide them with the resources that they need to get to where they want to be, we're trying to take a more prospective and proactive approach. And so if we can go to the next slide. Options counseling, as it has historically been rendered, which means that an options counselor is meeting directly with members to provide information about community-based programs, Medicaid resources, private pay resources, and so on. As I reflected, this has been a fairly responsive approach in the way that options counselors will meet with members once they receive a referral, and those referrals are generated from one of those locations, but we're not doing a lot to actually outreach historically. We've been largely making sure that we have awareness in the community of the programs and that people know how to access the programs. But in-reach counseling allows us to take that next step forward. So we will be building a much more proactive and prospective approach to counseling, wherein our in-reach teams and in-reach counselors will be going into these skilled settings to meet with members, to meet with facility staff, to provide education about the resources that are available to members. And in the future, in-reach counseling will also provide an opportunity for ongoing check-ins with members while they're in the nursing facility. Historically in Colorado, there is not a lot of oversight from case management or entities outside of the nursing facility for members while they're there. And so moving forward, we're excited to bring a much more person-centered approach and a much more person-centered approach to how people are accessing this. And so if they learn through one of those presentations or discussions, or through one of the ongoing monitoring visits, this is an approach that we hope will not only help reach people more directly, but will also really be a vehicle to cultural change within the nursing facility community, such that if the facilities are aware of the resources available, if members and families are better aware of the resources available, we have an opportunity to really ensure that the people that are utilizing our nursing facilities and our intermediate care facilities need that level of care. And for those that are able to support themselves independently, this is a way to ensure that we're getting that information to them in a much more directed and person-centered way. And so as in-reach counseling is implemented, options counseling in its historical model will be rolled into that process. And we'll have a lot more outreach or in-reach about the program as it evolves. So now looking at MFP member enrollment. So following options counseling or in-reach counseling, once the transition coordination has the options counseling or in-reach counseling process, once that member has identified that they want to move to the community, that they want to pursue money follows the person, that counselor makes a referral to a transition coordination agency. And so once the transition coordination agency has been assigned to work with the member, they are responsible for documenting the process in the state's prescribed case management system. The documentation will include capturing program eligibility information. It will document the transition assessments, the transition plans, the risk mitigation plans, and ongoing case notes and other program information that are relevant to that member's case, so that if somebody at the state or somebody from one of these agencies needs information, they're able to access it via our prescribed case management system. So that the department may track and better support Money Follows the Person as a program. Once a member has decided with the transition coordination agency upon MFP as their path to community living, the TCA or the Transition Coordination Agency will complete the MFP Transition Services referral form that's linked here in this presentation. But the referral form captures program eligibility information as well as MFP services information that can be used to inform the long-term care planning process and ensures that the state has oversight of who is involved in the program. So if there are any issues, we have the ability to dive in and work with members as quickly as possible. We can go to the next slide. This is just a brief overview or snapshot of the opening of the transitions referral form. So this will be, as I said, available to you via the link in this presentation and will be made available on our website. This is just an indication that the form is intended to capture really high level and basic information. And so within this, you'll be able to identify information about the member's providers, the member's demographic information, where they have been living and what facility they're transitioning from, whether or not they do meet all of the eligibility requirements, whether they require housing assistance needs, and whether any of the Money Follows the Person supplemental services such as housing assistance or our other housing resources are required for this member. So this will be made available online. We hope that it's pretty self-explanatory and straightforward. And will be an easy way for us to keep tabs on who is in the program. Again, if we need to, we want to be able to dive in and work with you as quickly as possible. If we can go into this next slide, I want to give a high-level overview of the process. I know that there are a lot of boxes and a lot of words on this slide, but this is a great visual reference of what the process looks like beginning to end. So as we look at this, once the Transition Coordination Agency accepts the referral, they meet with the member and they develop a transitions options team based on that member's choices. So whether or not they have family members or other providers or resources that they would like to be included in their discussion, a transitions options team is created that really supports that member across their needs from beginning to end. The team then will complete together a comprehensive assessment to determine what services and supports the member may need in the community. And as we continue to move along, then the risk mitigation plan is developed to create strategies to mitigate any of those identifiable community risk factors. The risk mitigation plan is really central and key to the overall transition and services planning. And once the TCAA is able to confirm with the member that they are interested in pursuing money follows the person, then this is where the TCA really starts working with them directly to identify their needs, to talk about what supplemental and HCBS services are going to be necessary for them to be successful. And following the identification and the discussion of those services, then the Transition Coordination Agency will reach out to identify providers based on the member's choice who are willing and able to provide the services as needed. Again, one of the benefits that we are looking forward to in this program is that for the supplemental services specifically, these will come at pre-authorized levels. And so for these situations, we are hoping that that really makes it more accessible and more enticing for providers to get involved right away, knowing that they're not going to have to wait on prior authorization. And so during this process, this is where those supplemental services are identified, where providers are outreached. And then once the providers have been identified, they will begin working with that member to develop their plan together. Once those agencies have been identified, as I just mentioned, they'll work with the member to actually identify what that looks like from them, and that from there, and then the TCA at that point is really central to all of the planning. And so as we start to prepare for community-based living, it's the Transition Coordination Agency's job to involve the other organizations responsible for key areas along the way. And I'll break out some of those roles and responsibilities as we close here in just a minute. So as we are looking at the roles and responsibilities, there are 4 key players I would like to review with you here today before we wrap up and see what questions you have. The local contact agency, and I appreciate your patience with me on the abbreviations so that I didn't have to try to fit local contact agency in that tiny little box. But the local contact agency is the options counselor, the in-reach counselor that we just talked about. This is where the process starts. These are the people who have an opportunity to really begin trust, to begin planning, and make sure that members understand what resources exist for them, that they know that community living is absolutely an opportunity for them, and that they know that there are different pathways to it. And then assuming that that conversation results in a desire for the member to move to the community, then the local contact agency will facilitate and send that referral to the Transition Coordination Agency. So now taking us down to that next screen, then the TCA is really that central role within this process. The TCA is one of the first people to meet with the member and will be one of the last that is involved all the way till day 365 once they're out into the community. The TCA is really responsible for the coordination of the majority of the members' needs. And so whether there are case management needs or medical provider needs or things that they are not able to provide, it's the Transition Coordination Agency's responsibility to involve those respective entities at the time and in the way that it makes sense for the member. And then once they are into the community, especially with the demonstration allowance of 365 days, they will work directly with that member to address their evolving and ongoing needs. So that initially a lot of those conversations may focus on safety and community acclimation, but perhaps focus more on empowerment and personal sustainability as it moves in. So the TCA is really the person that's kind of there through it all. And the one that's doing the majority of the central coordination. Next slide, please. The case management agency and the RAIs are ultimately kind of involved as they are. We haven't done a lot to change the responsibilities of either the case management agency or our regional accountable entities in this program. So the Transition Coordination Agency is going to handle a majority of the coordination and collaboration that needs to occur prior to HCBS. And that transition coordinator, once they have identified that the transition is likely and they've identified a likely date and time for that transition, they will work with the case management agency at that time to ensure that the level of care, functional eligibility, and financial eligibility review are all initiated so that when that member is ready to discharge, they have been approved for HCBS services, and we can, in some ways, sort of hand that part of the care and coordination over to the case management agencies so that TCAs can really continue to focus on that member, their well-being, and the needs that exist kind of between each of these roles. The regional accountable entity will still be there to ensure that we're able to fill some of the real cracks that exist. And so specifically looking at a member's physical and behavioral health, if we need help setting up a physician or getting doctor's orders or medical records, the RAY will continue to be a resource that's available to members eligible, and will continue to focus on those physical and behavioral health needs. We can go to the next process, or the next slide. So we are in the process of implementation now, and we'll be having more discussions early next year about what some of those specific timelines and requirements look like. For today, what I would like you all to walk away with is an understanding that we will be implementing the supplemental services in stages. So beginning in January 2025, so next month, we will be able to offer MFP housing assistance and environmental adaptations to members through our contracts. So we are planning to implement housing assistance and environmental adaptations January 2025. We will be implementing those services built into the system. So MFP peer mentorship, pre-tenancy support, and food assistance will be available in March of 2025 when the state's care and case management system goes live. Those, again, will be pre-authorized in the system. And so we're hopeful that that will help move support and resources along. Just to provide a little bit of information about Money Follows the Person and what it might look like as we move forward. MFP was originally authorized by the Deficit Reduction Act of 2005. It continues to receive a lot of bipartisan support at the federal level. And so there is always a chance that the program may be extended again at the federal level. It was initially intended to end in 2019. And here we are several years later, where recently the Consolidation Appropriations Act of 2023 has made MFP available to states through fiscal year 2027. So what that means for us as we are looking at launching our new demonstration is that we will be able to operationalize and fund our Money Follows the Person demonstration through fiscal year 2027, where we make our final budget request to CMS by September 30th of 2027. This final budget request will allow us to spend that money on operations for that following year, and then for 4 years of closeout to follow if there are additional needs. And so when we're talking about sort of what to expect, we're really talking about these programs coming to fruition and engaging in a lot of development between now and roughly 2028. We will absolutely let you know if there are any additional changes at the federal level. As I mentioned, there do continue to be conversations both in the House and the Senate with bipartisan support. So it's not out of the question, but at this time, we are looking at making our final budget request for this program by September 30th of 2027. And we hope that this will allow us to continue to learn valuable lessons about what it means to support somebody who is moving into the community. And so ideally, if we are able to make some headway and create some good results out of this, it'll be an opportunity to look at additional programs that we might be able to integrate into Colorado's Medicaid program moving forward. We can go to the next slide as we wind down here. I wanted to make sure that you all had information about what to expect next and what to keep your eyes out for. So we will be releasing published guidance, written guidance through our department's memo series. Those memos are in the clearance process now, scheduled for release, and we will be providing that guidance and information in 3 different memos. There will be an informational memo released in the very near future that ultimately mirrors this conversation and provides a high-level overview of what MFP is, who it serves, and how to access that program. We will also concurrently be releasing an informational memo that will outline provider enrollment processes and service requirements so that providers who are interested in participating in this program are able to begin that process and look at whether or not any changes need to be made to their provider enrollment in order to get involved in these services and programs. And then to build on this further, we will be releasing an operational memo that outlines in much greater detail the roles and responsibilities and operations of the program. This is where we'll get into information about the service requirements, the provider requirements, and the actual operations of the program in much greater detail. So where we reviewed high-level information today, we'll get into more of how that actually all works and connects with that operational memo. To support the discussion more externally, we do have additional training planned. So today I'm offering a high-level overview. We'll make this presentation available on our website, and we'll make the recording available for others to listen into. So please, if you have anyone in your network that is interested or wasn't able to attend today, keep your eyes out for that. And I would highly recommend that you share this with anyone that you can. And then in January, we will be hosting a MFP services and providers training that will directly mirror the level of detail in our operational memo. So the MFP services and providers training in January will get into those specific requirements, the authorization process, the billing process, the provider enrollment, and those things that are much more applicable to those very directly involved in supporting this work. And I would also leave you with the link to our website at the bottom. So whether you are interested in learning information about our permanent and ongoing transition services, or you're interested in learning about our Money Follows the Person demonstration, or more about this Transition Stakeholder Advisory Council and future opportunities to participate here, I would encourage you to take a look at our website, and that link will be made available to you with the presentation when it goes out. So with all of that said, that brings us to questions. I would like to offer time for any questions that you may have, with the reminder and the caveat that if your question is more specific to the actual services, to the provider responsibilities, or to the operations of this program, I would prefer that we save that conversation for next month, where we can have a holistic and robust conversation about those areas specifically. But today I would like to entertain any questions that you have about the high-level program overview that we've just gone over together, and anything that I might be able to clarify. So with that, I thank you, and I will see what thoughts or questions you have. Oh, I will start. Pat Cook. How was the 360 devised? For many, this was below the successful implementation date. 15 minutes can be used each visit just in conversation. I really appreciate that feedback. I think that that's helpful to know what the challenges look like in terms of the time available to you. 360 was roughly calculated based on the existing number of 240 and looking at the fact that we were projecting out the level of care for an additional year. So it was identified as a place to start. We we don't necessarily want to limit potential ideas or opportunities in the future. And so I think we'll learn over this next implementation whether or not that is something that we need to explore further. I would also like to just make people aware that if you are in a transition working with a member and 360 units is not enough, the state does have a process wherein we will be able to approve exceptions for above those cases. And so if you're in one of those situations and you're coming close to your 360 unit allotment, please feel free to reach out and we can talk with you about whether or not additional units can be reimbursed or whether or not there are ways we could manage care with what you have. Rachel Galano, what is an example of a regional center? Is one the Colorado Mental Health Institute of Fort Logan, since consumers may reside 60+ days? Great question. Fort Logan is specifically what is called an IMD, or an institution for mental disease is what it stands for. Regional centers and intermediate care facilities are connected and are designed specifically to serve members with intellectual and developmental disabilities. And so our regional centers exist in Pueblo, Grand Junction, and Wheat Ridge. I don't know that each of those is also an intermediate care facility, but the difference occurs based on their long-term needs. So where regional centers and intermediate care facilities may exist in the same setting or with the same providers, a regional center is considered an HCBS benefit. So a regional center is a much more intensive level of care for members with intellectual or developmental disabilities to receive their ongoing HCBS supports in a very structured, very intensive setting. An intermediate care facility can be provided, again, by some of those same or similar providers in some of those same or similar settings. But the intermediate care facility is for people who are not able to live successfully in the community. Intermediate care facilities require that people are legally designated to be there, and the level of care that they receive there is greater than what would be available at in a community setting or even at the regional center. Lisa Payne, CMHIP has a civil side. They have a forensic side that has FCBS services that provide similar services to transitions. I very much appreciate that feedback. And if you'd be willing to explain a little bit more, I am not familiar with either of those acronyms. So if there's either a resource link that you'd like to provide or perhaps a clarification you'd like to add to your question, please feel free to come off mute now.
Hi, so CMHIP, and I'm not sure about Fort Logan, but CMHIP, which I have worked at before, they have what is a forensic side, which are people who have been found NGRI. And through the forensic side, there is forensic community-based services. And they've been doing it forever, and they facilitate helping these people get back out into the community when they are deemed appropriate. However, they also have a civil side, and a friend of mine who is a PA there, he and I have talked over the years. They do have people on the civil side who have been in over 60 days and they cannot find appropriate housing for them. So we have never pursued using transition services, but that is definitely something that we could do because it's not a forensic based, it's a civil based, and they are institutionalized.
I really appreciate that feedback, Lisa, and I understand where you're coming from now. And you actually have highlighted an area of growth that I would really like to see how we can better support, because you're exactly right. Each of these settings have programs that in some way, shape, or form help members, quote unquote, transition to the community. And so for that reason, we haven't really had a lot of integration or success supporting those members. And so I think that this would be a great beginning to that ongoing conversation. And I would certainly love, as this evolves and we discuss more, if you have insight or ideas. But yeah, you are spot on. That's very much an area that I would like to have some greater communication and success with.
Great. I would love to do that. So let's talk.
Thank you. I appreciate it. How is the $500 going to be given to clients, either through a card or a voucher? So the food assistance, the MFP food assistance, will be made available at $500 per member for the first 30 days following their discharge. This service will be built pre-authorized to $500 into the state's Medicaid management system. And so while there will not be a PAR in the same way that we have utilized PARs through case management agencies, the claiming or the billing will still happen directly in our Medicaid management system. So this would be a reimbursement model similar to our transition setup or household items, where depending on the member, the actual purchaser may look different, but it would require direct billing to Medicaid for reimbursement.
Got it. Thank you.
Of course. These are great. What other questions do you all have? Anything you love or hate about what I've shared so far? I'd love feedback too.
So actually, I do have a question. This is April again. So on that topic of CMHIP clients, as an option counselor, then so the referrals would come through me, and then I would have to go through to CMHIP, correct? Like if we start working on that model.
Yeah, I think for
Okay.
direct guidance, I would prefer. Ultimately, yes, but I think that given the challenges that we've faced, we probably have some work ahead of ourselves to be able to uniformly offer that pathway for these members. And so I think when we talk about actually getting more involved in those settings, we probably have some work or conversation that we should talk through before making
Jumping in
anything
there.
super official. But the idea is ultimately that the process would occur the same way. So it would begin with that referral to an options counselor. The options counselor would meet with the member in the facility. And where it gets challenging is just identifying then what resources need to be utilized where, because as we walk through, a big part of what the Transition Coordination Agency is doing is identifying those resources that exist, those resources that are necessary, and their role is really coordinating and carrying a lot of that work directly. Where these settings also have some of those resources, it becomes a little bit more challenging to identify who and where should be responsible for what. And so that's where I think that if we can have some more programmatic discussions, maybe we could offer some better insight. Also, for those on this call, this is a very, very nuanced and specific part of this process. And so it will not be widely relevant, but to answer your question, yes, basically. And if you would like to work through some and what that actually looks like for a member you are working with, please reach out.
Got it. Thank you.
What other questions or thoughts do you all have? And if we wouldn't mind just going to the next slide, this is my last slide, but it contains contact information. So for the purposes of this demonstration, we are asking that any questions thoughts, feedback as it relates to the Money Follows the Person demonstration be sent to the MFP inbox that is listed here. This inbox will be managed and overseen by our team, and so it will be the most direct way to get an informed and a timely response, and we'll ensure that whoever is managing this inbox involves anyone necessary for that situation. So if you have questions, feedback, or ideas, please send those to the MFP inbox. We've all worked together for quite some time, so if you have any questions for me, I think you know how to get a hold of me, but for purposes of today, I'd like to keep the communication going to this inbox. So with that, if there are no other questions, I really appreciate you all. We would not be in the position that we are to be able to move forward with all of these new programs without everything that you have done. This is a tremendous group. I am proud to be a part of this group. And I think we're going to do some really cool things. So thank you. Thank you for helping us get to this point. And thank you in advance for everything that we've got coming up. And with that, I will then end the presentation. I don't want to avoid our open forum. And so as far as our meeting goes, this will end our formal presentation and discussion. But if any of you on the call have general questions that we haven't reviewed, you have updates for your organization or success stories that you would like to share, or questions for any of your peers, we do still have 21 minutes, and I want to make sure that space is available to you now.